the Australian Medical Association is calling for a new regulator to oversee the private health system, control premium rises and drive reforms in the sector, warning that the industry is on the brink of becoming unsustainable. The private health insurance industry has been described as being in a death spiral as younger people abandon their policies and older people who draw down heavily in benefits take out policies in greater numbers. It is really interesting to me to have a bit of I did a bit straw poll of a couple of my mates over the weekend, Caleb, and the majority of them don't have private health insurance, and we're not that young.
Yeah, oh, well, don't say that, Jenna. You are a young
spring
woman.
chicken.
I may be by far the youngest sitting here, but you're still young, Jenna. You don't write yourself off just yet. But you're right, though. In general, younger people are abandoning private health care. And I think the main reason for that is that they don't see immediate value in it. Now, young people these days, who of course are facing rising house prices and this kind of thing, have to be scrupulous about how they spend their money and where it goes.
Of course.
And so if you're looking at, well, I can take out private health care now, which means it'll be more affordable by the time I'm 60 and 70 and I probably need it.
Yeah.
Or I can forego it and deal with that problem down the line. That's what a lot of people are doing. What the government needs to sit down and work out is whether it is more cost effective to bankroll the industry and take control of it or to let it go and invest that money in public health care. That's why the federal government invests so much money in private schools, because it is actually cheaper for the federal government to spend more money on private schools in the long run. Whether or not it's the same thing for health, I would be interested to see, and if it is, they'd be stupid not to be doing something about it.
Yeah, it's going to be interesting if they heed the medical union's calls there.